Hello. Welcome, Ian.
Thanks, John. Thanks for the invitation.
No, my pleasure. I thought it'd be a great idea for me to have a chance to interview some of the leadership team at Arvinas and hear a bit about their journey, their career path, and some of the highs and lows as they got to Arvinas and how they feel at Arvinas. And I thought we'd start off by introductions. Obviously, that's the best way to start. My name's John Houston. I'm the CEO and chairperson of Arvinas, and Ian is the president of R&D at Arvinas. So with that, Ian, it'd be great just to get those initial thoughts about your career journey, how you started in this business, and how you moved through the industry to where you are today at Arvinas.
Sure. Yeah. Well, it's been a long journey because I'm old, John, as you know. I'll actually take you back.
Not as old as me.
We're close, but you're right. Yeah, I'll actually take you back even farther in my career. You know, I was raised by a proud single mother who was a high school biology teacher in Belmont, Massachusetts. She was a teacher in Cambridge. I was raised in Belmont, Massachusetts, and I think my interest in biology really came from her. She was probably my first big influence, as a lot of mothers are. And I went to college in Maine and majored in biochemistry, and it was not till my senior year that I really knew what I wanted to do. I took this molecular biology course, and I said, "Oh, molecular biology, this is cool." Recombinant DNA was really early days back then, and I was lucky enough to get a summer internship at a lab at Harvard, which is basically the next town over. And that's when I really started thinking about having science be a career. And took a year off after college to work in that same lab, just really to get a sense of, can I do this like 5 days a week, 8 hours a day? It's one thing being in a lab in college, a couple hours during the week. It's fun to fool around, but can you really actually do it day after day after day? And that proved to me that I could. And then went to graduate school at Harvard. That was a long 5.5 years. But obviously learned a lot, and then was lucky enough to do a postdoc with Harold Varmus, who had just won the Nobel Prize like a year earlier at University of California, San Francisco. He eventually became the director of NIH. I went there. And so after about 4 years of a postdoc, so 4 years of college, 5.5 years of graduate school, 4 years of postdoc, my friends were saying, like, what are you doing? Why is it taking so long to get a real job? And I started interviewing for academic positions. I actually got a couple offers, but just about then I got a headhunter call for this job at Bayer Pharmaceutical. And I was like, Bayer? I didn't know Bayer was in the United States. I said, well, they used to be Miles. They just bought back their naming rights, and they've got this position. I said, well, yeah, okay, that's interesting. I'll go up and interview. Eventually took the job. Started off just as a lab head with 2 research associates, one of whom actually works at Arvinas, as a small world story, and was in the inflammation group. When they hired me, I said, I don't know anything about inflammation. I've been doing mostly cancer research. And they said, that's okay. You've got transferable skills. Something I've remembered through the years about hiring people with transferable skills, actually. And I think they obviously knew, because within 3 months, the inflammation group was subsumed by the arthritis group. At that time, they were separate. And all of a sudden I had a new boss. And then 18 months later, Bayer decided to exit arthritis. And I was like, whoa, okay. So this is my introduction to the way pharma can work, right?
All right.
Things change all the time, especially in big pharma. At that point, then I went into a research technology group, kind of like our platform group here. We did a lot of setting up for high throughput screens, which was very interesting. Ultimately, it was one of these classic things at Bayer, just getting jobs of increasing responsibility. Ultimately, I returned to my roots in cancer biology, became the vice president of cancer biology there, and responsible for delivering compounds to development, much like the research group here at Arvinas. And I was lucky enough to put 3 compounds into development. All 3 of them have been approved. But then Bayer, another big pharma twist, Bayer bought Schering in Germany, decided they were going to exit the US, closed the West Haven site, which is now Yale West, down the road from us, and was fortunate enough to get a job at Pfizer in Groton. Actually, at the time, it was New London, in oncology drug development. So I moved from research to development. I started off in actually translational science, probably for 5 or so years, and then ultimately became and during that time was great because I learned all about development from early phase 1 to phase 3 and actually beyond. Actually even wrote my own protocols for window of opportunity studies. So it was like a deep immersion into development. Then that parlayed that into becoming an early development team leader, running phase 1 and phase 2 trials for a few compounds, which is a really fantastic experience. No one reported to me. It was completely matrix, so in terms of developing leadership skills and influencing skills, it was really tremendous. And then, Arvinas came calling. Pretty much I've been at Arvinas 8 years as of June 1st. And, it just seemed like an opportunity I couldn't turn down. I actually said that to my wife. I said, if I turn this down, I think I'm going to regret it. And I would have regretted it. It's been a great ride. It's been so much fun and such a learning experience. And, the success we've had building the company, you coming, basically 6 months after I started, you started. And so, being part of building this company to where it is now has just been a fantastic experience and just something I'm really, really proud of.
That's great. And we'll come on to, what attracted you to Arvinas in a second. But I mean, obviously, fabulous kind of career path and intriguing big pharma companies. Along that path, did you have key mentors and people that helped you and gave you guidance along the way?
Oh yeah, definitely. I can think of 2 for sure. Starting off at Bayer, when I joined a gentleman named Hiren Vasavada, a molecular biologist as well known in the Connecticut circles. He's been around for a long time. He definitely took me under his wing from the start. I wasn't reporting to him. I eventually did actually for a while report to him. At the beginning, we were just colleagues in the same group. And, coming in from a postdoc, I didn't know anything about drug discovery. I knew about science. I knew about, the technologies, PCR, all the stuff that we were doing back then. But I didn't know anything about drug discovery. And he really taught me a lot about what it took to do, to basically start to finish from drug discovery, from target identification to expressing validation, getting in high throughput screening, testing the compounds, et cetera. And obviously helping with just the way that Bayer worked. And he was just a tremendous advocate for me in my career, was always pushing me forward, making sure that I had opportunities to get these greater responsibilities as I went through my career. So I actually, in terms of my Bayer career, I owe him, Hiren, so much. I think sometimes he actually did it, even sacrificing some of his own opportunities to give to me, something I've never forgotten. And then when I went to Pfizer, I was, as I said, I was VP of cancer biology. When I went to Pfizer, I actually was a director and took a step back, really wanted to stay in Connecticut because of my family, my kids at a certain age. But I figured, if I'm going to take a step back, at least go into development, I'll learn something completely new. And then the head of oncology development at the time in New London was a woman named Karen Ferrante. And she was basically my boss's boss. My boss was actually, we were in Connecticut. My boss was in California. He reported to her. It was, this cross-country thing. So I didn't really have anyone local that I was reporting to. But she's obviously a busy woman, but she, again, spent so much time with me, again, teaching me development, right? And letting me bounce ideas off of her, just understanding the ropes of Pfizer, this huge, big conglomerate. She didn't have to do that. Again, I wasn't reporting to her, but she took particular interest in me because she knew my situation coming from Bayer and wanted to make sure I had the best opportunities possible. And I really owe her a lot as well, making my transition from research to development to Bayer to Pfizer, totally different corporate culture, that much smoother, and really helped, kind of get me started at Pfizer. So those are the 2 people that, when I think about my career, that I owe them a lot. And hopefully I've told them that over the years. I'm not sure.
Well, you've told them now, that's for sure.
Yeah, hopefully they'll watch it.
They'll hear this.
Yeah.
Well, that's great. It's always great when you have mentors that can guide you along and help you at certain points on the journey, which is fabulous. And of course, in that journey, it's R&D, so you always have challenges and hurdles. When you look back in that period of time, the kinds of challenges you had and how you overcame them and how you kept motivated all through that. Yeah,
well, I think, certainly the closing of Bayer was a big challenge. We had people, I think, a 400 people site, and that was just everyone was losing their job, right? When you close the site, it's like, and I guess that was the good thing, is we were all in it together. It wasn't like a layoff where certain people got laid off, and so that was a challenge. But I think just in general, when I think about challenges, I think just drug discovery and development is the daily challenge. I've said this before when I go to speak at schools and things, 90% of what we work on in research never makes it into development. And 90% of what we put into development never makes it to the market. And so it's really just a tough business. You're dealing with biology and chemistry and doing clinical trials, and so much we don't know, even though we think we know it, we don't really know it. And just that's just the challenge, the daily challenge of just overcoming what we don't know, but really just being focused on delivering medicines to patients. That's what gets you up and coming to work every single day in this face of almost certain failure of your program. I talk about this to people in outside businesses. They're like, what? Like 99% of what you work on is going to fail? I mean, if that was my business, we wouldn't survive. And I said, well, yeah, that's the business. And they're like, really? And I'm like, yeah, but the reward coming on the other end is so fantastic. That's what keeps you going. And you look around, certainly when working in cancer, as we do, and certainly neurodegenerative disease, when you see the unmet medical need. I mean, every one of us knows somebody, whether it's a relative, a neighbor, a friend, who's been touched by cancer, right? Same probably for Alzheimer's and Parkinson's. That's becoming more prevalent. People have somebody in their family who's probably suffering from some form of dementia. So that's very relatable, right? And that's what's at boy, if we could just help these people and people like them, that's worth staying motivated in the face of this high failure rate and coming to work every day and doing the best that we can. That's always been the driver for me. In fact, I told Harold Varmus that when I took the job at Bayer. I went into, I said, I'm going to take this job at Bayer. He goes, I thought you were taking one of these academic positions. I said, no, Harold, I decided, I know I'm not going to win the Nobel Prize. I'm just not going to, like you. I'm not like you. But the next coolest thing, that would be the coolest thing. The next coolest thing I can think of would be to be part of a drug discovery program that actually delivered a drug to patients and helped them. And I've pretty much lived that way through my career. That's as true today as it was back then, which is many decades ago.
Yeah, that's fabulous. And of course now, with the experience at big pharma and dealing with the the hurdles that come along with that, what did attract you to join a small company called Arvinas? You must have been like employee number 20 something.
I think that's 30. Yeah.
30.
Yeah. Well, it's in the end, it was at the beginning and the end, it was the technology, right? It was the PROTAC technology. Degrading a protein rather than inhibiting it. I've been working in inhibitors my entire career. So the concept of actually removing it, degrading it, was really intriguing. And then the potential ability to go after undruggables, these targets that, you and I know have been out there forever, just the holy grail targets, so to speak, that if we could just hit them, we would really have a major impact on disease. We all know what they are. They've been intractable for decades for various reasons. But the way the PROTAC technology works really had the potential to be able to do that. And that really intrigued me and really drew me to say, well, okay, we could really do something completely different, not just different in terms of degrading versus inhibiting, which clearly, we've been able to show certainly in the research stage and hopefully in the clinic. That's fantastic in and of itself, but then to go after these really hard targets, these impossible targets, these targets that would be transformational if we could hit them, that was just too good of an opportunity to pass up. And it checked off the other boxes. It was in Connecticut, it was in New Haven, it was early days, so I felt I could really impact the direction of the company. And the people I met at the time, and obviously you coming after 6 months, we just had a fantastic team. And I just felt that we could really do something. And that's what attracted me then, and it's what still jazzes me about the company today.
That's great. And did you find that your big pharma experience translated in any way into that small setting?
Well, I think so. I mean, certainly for Bayer, even though Bayer's a big company, it was located in Germany. We were West Haven. We were kind of just like little outposts. We weren't a big site. I mean, we had development and regulatory, but in terms of research, we're probably about the same size as Arvinas is now. So I feel like we had an entrepreneurial spirit. Even though we were part of this big company, we were kind of this little outpost that Germany kind of always looked at and said, what are those guys doing? So we were kind of scrappy, right? Because we had to prove to the mothership in Germany that we were worth something. We were actually being productive. So I think that mindset I had from back then, it was a little different at Pfizer. It's not quite the same. They like to say we like to say we were nimble, and maybe we were, but not the same as Arvinas. So that part, I think, definitely, I already knew what it would be like to be sort of in a smaller environment. And then I think having both research and development experience that I got from Bayer and Pfizer, respectively, really helped me, because when I joined, again, just a little bit before you did, there weren't that many people who knew about drug development. We only had 2 or 3, certainly nobody in research. And so to be able to help guide the group, the research group, the biology and chemistry, in terms of, okay, this is what we need to accomplish to actually be successful in development. It's different than certain, what you might think of. I think having that perspective, that's one of the things I feel like I was just in the right place at the right time and had the right experience, both research and development, to be able to help Arvinas at that particular time when we were just getting into oral bioavailability. That for going into breast cancer and prostate cancer, that was a must. That wasn't an option. The compounds at the time were IV. I said, these compounds are nice. As you know, you came in basically saying the same thing. These compounds are nice, but if we're going to be successful, we have to figure out how to do oral. Exactly. And I think that really, between you and myself and Andy Crew at the time, that really helped shape the direction in face of all the skepticism that we had, that we would be able to do it, right? No one believed we'd be able to do it. In face of all that skepticism, to be able to sort of give that guidance and actually then do it was probably the biggest thing I brought to the table at the time when I joined Arvinas.
One of the things I noticed when I joined Arvinas was the culture. It was such a kind of community spirit, get at the problem type of attitude. What was your view of the culture, and how do you see it now? Because the company's clearly changed a lot in the intervening years. No,
that's a great question. I think certainly I totally agree with you. When people ask me about the culture, certainly when I'm interviewing people to join Arvinas, I'll say, they'll often ask, what do you say is the culture of Arvinas? And I say the culture of Arvinas, we have our values, pioneering being one of them. That's certainly part of the culture, pioneering spirit. We were the first. We're still in the lead. We want to stay there. Absolutely. But to me, when I think of Arvinas and the culture, I think of teamwork and togetherness. And as you said, when you joined, that's what it was. I mean, we were smaller, obviously, but we worked together. We may not have liked everyone that we were working with, right? That happens when you're in a company. But we worked together because, A, we were all jazzed by the technology. B, we wanted to make it work. We had to make it work. And the only way to make it work is to work together. And I feel like we've still, even though we've grown and now we're hybrid and remote and we have people in 25 states. I think we as a leadership team, in Britain, and we as a leadership team under your leadership, I think we still focus on the culture of working together. For example, we just had the company picnic, right? So we pay for everyone to get together once a year to, that you may only see each other on a Teams call, but we're going to get together and we're going to be able to talk with our colleagues and have fun, and then pay for people. They come and they have their team meetings as part of the adjunct with the company picnic, and we do that. We allow teams to come together. We encourage them every quarter or twice a year, because teamwork is so important. And I feel like that we've been successful, even though post-COVID we've become a completely different company, and we've obviously grown. I think it still comes down to teamwork is what makes us successful.
Yeah, definitely. Totally agree with that. And of course, now, as you say, you've gone past your kind of 8-year anniversary fairly recently. So you've got a chance to look back, right? And say, are there things that you're kind of proud of what you've achieved in the 8 years at Arvinas?
Well, yeah, there's a lot, and it's changed over the course of the 8 years. But I would say that in the end, the accomplishment of getting multiple compounds into the clinic. Again, as you know, in the early days, so much skepticism. Can you really make these oral? Can you make them blood-brain? Can they be drug-like? These are big molecules. This has never been done before. This is not going to work. The skepticism, even when we presented the data, the first PK data, people were still like not believing. right? So to be able to, with bavdegalutamide and ARV-766 and vepdegestrant, of course, and now ARV-102 and ARV-393, have 4 or 5 compounds in the clinic being tested in humans, and with a new technology, something that no one's ever done before. Again, I say that to people that interview. I said, you've been working in small molecule space all your time, but you'll be doing, because we're still learning about the molecules, as you know. We're still learning about PROTACs. We've been going for, 11, 12 years. We're still learning. Said, you're going to learn things about these PROTACs that no one's ever learned before. That's a great opportunity. To me, that's still what drives the attraction of Arvinas, is that we're the leaders, the pioneers, and you're going to be learning something that no one's ever learned before. How cool is that? So in the face of all the skepticism and learning, to be able to get into patients with multiple compounds now, with a brand new technology, a brand new modality, again, something no one's ever done before. I'm really proud of the whole company, again, pulling together and doing this, not just once, not twice. Anyone can get lucky, right? We've done it multiple times, and I'm really proud of that.
That's great. And of course, looking forward then, I'd imagine you've got great ambitions, aspirations for the company going forward. What would they be?
Yeah, it comes back down to one of the things that drew me to the company, which is the undruggables. And we've had some success there. BCL6, for example, I think had been viewed as undruggable. Now we have a compound that's in the phase 1 is starting. But to really be transformational, that's the area that I really want us to be able to be successful. And these are really hard targets. And of course, we've built up our screening capability to look for ligands to bind to those targets. I mean, they're really hard. They're undruggable for a reason. Decades and decades of people have been working on them. I think PROTACs still have the best opportunity to crack those nuts. And I just like to, that's what I have the aspiration of the company, to do that more regularly. We've learned a lot. It's research. So we've had fits and starts. We've had successes and failures along the way. These remain hard targets. PROTAC being a cool technology doesn't change the fact that they're hard targets. But I think we're getting closer and closer and closer to being able to hit a lot of those hard targets. And that would be just amazing if we could do that more than we've done so far. So we're going to keep working at it. That comes back to that 90% failure rate. We're going to get knocked down. We're going to get back up. We're going to try again. We're going to try something different. We're going to learn from our mistakes, like Thomas Edison and the light bulb, right? I mean, I don't know how many different light bulbs he made before he finally got it.
More than one.
Yeah. So, but I firmly believe that we're going to get there, because the technology can do it. We just have to keep at it. So that's my goal and aspiration.
Totally agree with you, and I do feel like we're just scraping the surface of the technology, and there's a lot more to come in understanding protein degradation and proximity-based approaches in the future. So I totally aligned with what that future looks like. Now, I know for a fact you can't just be working all the time. So we've been talking about your career, this whole section, but what do you do in your spare time? I think I can guess, but what do you do in your spare time to relax?
Yeah, no, you can guess. I'm pretty well known, probably not universally at Arvinas, but pretty well known as an avid golfer. Oh, I did notice that. I was going to mention that, John, the Masters shirt. Yes, I love that. I actually have a Masters towel that someone gave to me.
Oh, yes.
That's that same person who's wearing that Masters shirt, which I'm still very grateful to, and I've not used it. It's pristine. No,
yeah.
It's on my shelf. It's on my golf shelf. A towel from Augusta National. But I'm pretty well known for being an avid golfer. So I spend a fair amount of my free time playing golf. I'm actually going to be the president of my golf club come September. And of course I'm president of R&D of Our-Venice now.
Yes, you're clocking up the presidentships.
Yeah. So here you go. So, but I also am president of our local town's land trust.
Oh, wow.
As well. So as of September, I'll have 3 president titles. I can tell you, John, that if somebody asked me, one of those HR questions 5 years ago, if somebody asked me 5 years from now, where do you hope to see yourself? being president of 3 organizations would not have been my answer.
Simultaneously as well.
It was never part of the plan, never part of the thought process. It just kind of happened. But I'm very proud to be president of Land Trust. So besides playing golf, which I really enjoy, also because of the challenge, right? It's very similar to drug discovery. You know, it's such a challenge.
Frustrating.
And frustrating, exactly. You need perseverance to play it, and maybe be a little crazy too. I don't know. But I'm really proud to be president of the Land Trust. I love hiking. I love the outdoors. I think it's part of my community service, giving back to my town. I've lived in my town for a long time, so I'm really happy about that. And we have a great board of directors, and so I spend a fair amount of my free time working on land trust stuff as well.
That's great. That's super. Now, I think we're more or less at the end of the time, but I just want to be sure there's any other parting thoughts in terms of how you think about your career and Bayer, Pfizer, academia, and where you are today at Arvinas that you want to pass on?
Yeah, sure. Yeah, and I think there's 2 things that I kind of go by in my career. One phrase that I think I'm also relatively well known for at Arvinas, certainly the research stage, a phrase that I always admit that I didn't come up with myself, but it's something that I tell people is like, drug discovery is done in humans. I always have to emphasize it's drug discovery, not drug development. Drug development's done in humans, but drug discovery is done in humans as well. And this, what we were talking about before is that, you can do we do all that we can in the preclinical models to deliver a quality candidate to the clinic. And again, as part of the accomplishments that you and I think share the pride that the compounds that we put forward have been really good compounds. But you don't actually learn about your drug. You actually sometimes don't even learn about the target until you get into humans. And that's why getting quickly as you can to the clinic, really being efficient in research to get those compounds to the clinic is important, because that's where you're going to learn in the end, maybe even about your target, but how good your drug is. So that's why it's really imperative that we go as fast as we can, because drug discovery is done in humans. It's not done in mice. Obviously, we do a lot of work in mice. It's not done in rats. In the end, it's done in humans. So I think that's one thing that I just always keep in mind. And then the second thing, of course, is a public company. I think this resonates even more, but it comes back to what we were talking about before in terms of motivation. What I often say to people at Arvinas is, because there's a lot of noise that happens, we've got a stock price that obviously people track, goes up and down. So you know what, just focus on the patients and the rest will take care of itself.
Yeah,
and
definitely.
In the end, that's what's driven me my entire career, just focusing on the patients, understanding the unmet medical need. It's not just the patients, actually, it's their families, as you know, right? You're helping more than one person when you're helping a patient. So if you just focus on the patients, everything else, the stock price, bureaucracy, whatever else might be bugging you, that'll take care of itself. And so I think that's kind of the touchstone that I've had for my career, and I think it's served me well, and hopefully others would learn and it would serve them well too. That's
super, Ian. I really appreciate the fact you took some time out of your very, very busy day with your multiple presidencies and other things. But great to talk to you, and thanks for your time.
I really appreciate the invitation, John. It's always fun talking with you.
Good. Well, take care.
You as well.